All right, guys, I've talked a lot about how we're always doing stuff out in front of us. A lot of us have just rounded shoulders just from normal everyday things. We're doing stuff out in front of us. Forward anterior or anterior head carriage is what we call this. And again, texting all the time, doing all those things that are out in front of us, bending forward. So we actually have a muscle in our back. It's called the trapezius. It starts up here in the shoulders, generally gets really tight in most people, and it actually comes as a diagonal down almost to where the lumbar spine is. As we use our upper traps a ton, we lose the function of our mid and lower traps. And weakness to those muscles is actually detrimental to us because one, we get really tight traps, we can get neck pain from that, pain in the middle, the back, because we have the weakness of that muscle because it's not doing what it's supposed to and bringing the shoulder blades in and down. So I prescribe this to a lot of my patients with shoulder pain, mid-back pain, and even neck pain because we're re-strengthening the middle and lower part of that trapezius muscle so the upper trap isn't doing the brunt of the work. I call these ITYW, and again, we're trying to strengthen that mid and lower trap so our upper trap isn't doing all the work. So I generally give a resistance band to my patients at home so they can go home and do this exercise as well. And I'm just going to show you how we do it here in the clinic. So you want to obviously tie it to some kind of sturdy object. And for this first one, we call these eyes, and my palms are going to be facing up to start. And I'm going to bring my arms all the way back, and I'm pinching my shoulder blades, trying to squeeze a pencil in between them, bringing them down and back. I have nice posture when I do this. I see a lot of people try to do it like this. Okay, so that's not really working those mid and lower traps. So really good posture. And I'll also show you these from the back just so you can see what it looks like in the back. So my arms are extended and I'm bringing it all the way down, palms facing the wall. So that's the I, so I, and then the next one is T. So I'm gonna go straight out, and again, I'm pinching the shoulder blades. My palms are still facing the wall. My arms are kind of in that locked out position, pinching that pencil in between the shoulder blades. And then the next one is, that was the T. This one's the Y, so I'm gonna come up in a diagonal, so reaching for each corner of the room. And again, my palms are gonna be facing the wall here, so Y. And again, I'm bringing my shoulder blades down and in, trying to pinch that pencil between the shoulder blades. And then the W, this one's a little bit more difficult to try to understand. Again, you wanna stand with nice posture. Obviously good posture for all of these, but this one especially. And then this one, the palms are still gonna be facing out, but the knuckles are gonna be up towards the ceiling. So I'm gonna come back, pinch the shoulder blades into that W position, kind of making a W with my elbows. And again, I'll prescribe the reps that you guys can do for this and how many times a day you should be doing this, but this should really help with that upper neck pain or upper trap pain, mid back pain, or some shoulder pain. All right, as promised, I said I would show these from the back just so you can kind of see what the shoulder blades are supposed to be doing for each of these exercises. So I, pinching down and back, T, Y, W. I'm going to do those again just so you can see. I, T, Y, W.